Welcome to the Chief Andrew Isaac Health Center.
Bringing healthcare closer to home.
It wasn't long ago that we were a small clinic operating out of what is currently the bowling alley here in Fairbanks.
The building is really beautiful, so I'm really excited for people to see the spaces they're going to be cared for in.
We're getting a lot of questions from people like, well, what else gonna be provided in the expansion?
The time when Chief Andrew Isaac Health Center operated out of FMH, I've heard about how crowded it was with people working in the hallways.
And when things look stark and institutionalized and don't reflect your land and your community and your culture, it can feel really alienating. And so creating this as a space where people feel safe and feel like it's a part of who they are contributes to their healing.
In 2009, I think roughly when it was when we started talking first about the need for building our own facility, and our full board had authorized us to start working on the construction of our own clinic. One of the elements that they had said was, we're authorizing it, but you have to make sure it's not a square box. It has to be a building that really represents us, that reflects our region, who we are, and it has to be a building where we feel welcome and we feel that it's ours. Early on in the design, we had pulled together a cultural committee. They really guided the design elements in the existing building. And so we wanted to carry forward in the expansion as well.
And so they really gave feedback from the onset that really manifested in all kinds of really cool aspects of the design, from the prayer room to the plant medicine themes that you see in every area of this facility to the cultural items that are going to be displayed. They really gave input into the entire process.
Early on, they had scale models of the preliminary design, and then staff were looking at it and literally walking through ideas of like, okay, for example, if I'm a nurse and I have a patient in an exam room who's located here, and now I need to have something that's not already in that exam room, where do I go? They were literally mapping out, is there a way that we can move all these potential rooms around so it makes more sense in the whole patient flow? It was a fun exercise because it was very interactive.
So that was really important for us to be able to include their perspectives and feedback and thoughts, because they know all the things that work right now and all the things that don't work. It's a circular effect. If we look after our staff and they do a good job, they're going to do a really good job of looking after our patients.
I hope when patients walk into the new clinic that they just feel the excitement that we've all had, and I hope patients really feel TCC's commitment to providing world-class and accessible services.
Our urgent care is going to be moving over, and we'll have more rooms available to see patients in and a dedicated space for urgent care, which is great. We're moving lab over, and we'll also be expanding the materials and equipment that lab has.
New services we will be offering are CT or CAT scans. Also an ambulatory surgery center where we will be able to do same-day procedures and surgeries. With our CT scanner, we will be able to quickly assess conditions like head injuries or abdominal pain joint problems, fractures, and investigating tumors. At the surgery center, we will be able to do procedures like colonoscopies, gallbladder and appendix removals, cataract surgeries, and dental surgeries. Additionally, we're adding another X-ray room and ultrasound room to our radiology program as we have great demand for those services. Also improved audiology or hearing testing, ophthalmology, which is medical treatment of eye diseases. We're working with Alaska Native Tribal Health Consortium to increase our field clinics by adding new specialties and to expand the availability of our orthopedics program with visiting staff from ANTHC. Other current services will expand over time as we were able to increase our capacity by hiring staff.
The other new service line is a cancer care clinic and infusion center. It's going to provide a lot more kind of like with the wraparound services closer to home, for sure.
I'm really excited for our community in the interior to really see what their investment is translating into, because it was the tribes and the chiefs that really backed this project, and they entrusted TCC to be able to deliver on it. As we expand, our investing in healthcare careers for our people, because those are really good careers. That's what I'm really excited about.
Our healthcare services have come a long way to a large 203,000 square foot facility that our tribes can call their own. Being able to complete a major project like this on time and under budget while addressing a global pandemic is not an easy accomplishment. I'm so thankful to the staff at TCC and our tribal leadership for making this project come to life. And the expansion is just one more step towards our vision of healthy, strong, unified tribes. Welcome to the Chief Andrew Isaac Health Center, bringing healthcare closer to home.